The outcome of a landmark federal opioid trial in West Virginia that reached closing arguments this week rests on two legally thorny questions. Was it unreasonable for three of America's biggest corporations, the drug wholesalers AmerisourceBergen, Cardinal Health and McKesson, to ship roughly 81 million highly addictive opioid pills to pharmacies in one small Rust Belt city on the Ohio River? If that was a reckless thing to do, does the addiction crisis in Huntington and surrounding Cabell County, West Virginia, amount to a public nuisance that the companies must help remedy? The answers to those questions will now be decided by U.S. District Judge David Faber in Charleston, West Virginia. His ruling, not expected for at least a month, could set legal precedents that shape corporate accountability for the opioid epidemic raging in thousands of communities across the United States. According to the Centers for Disease Control and Prevention, more than 500,000 Americans have died since companies began aggressively marketing and distributing prescription pain pills in the late 1990s. Experts believe the flood of opioid medication served as a kind of gateway, igniting a deadly second wave of addiction and overdose deaths linked to heroin and the synthetic opioid fentanyl. In his closing arguments, attorney Paul Farrell, who lives in Huntington and represents Cabell County, said evidence is clear that the company's business practices caused serious harm. It was a blowout, Farrell said. We had 81 million pills that came flooding into our community. And it wasn't by accident. Somebody delivered those pills here. According to federal data made public during the trial, the pills were shipped to the community from 2006 through 2014, years when America's opioid epidemic was surging. Officials in Huntington and Cabell County are asking Faber to award them up to $2.5 billion in damages, money they would use to help ease the opioid crisis. The companies deny any wrongdoing and say the huge shipments of pills, which they acknowledge occurred, reflected trends in opioid prescribing practices by doctors, which were out of their control. "We're a mirror of what's happening in healthcare," Enu Mainigi, an attorney representing Cardinal Health, said in her closing arguments. "We reflect it. We do not drive it." Public health experts say the ruling in this landmark federal case will define the public health response to the opioid crisis in hard-hit West Virginia for decades to come. It could also shape the legal strategies of thousands of communities across the U.S. currently suing the drug industry over companies' role in making, distributing and selling highly addictive opioid medications. Over the next 150 days, those communities will decide whether to accept a $21 billion national settlement offered by AmerisourceBergen, Cardinal Health and McKesson.